We are on your side this morning as another group of Columbus City School students head back to class this morning.
The second group of 6th, 11th, and 12th graders will start blended learning today. Meanwhile, students in 7th, 8th, 9th, and 10th grades will go back March 22nd and 25th. With us live this morning is Laura Paynter, the Buckeye Health Senior Director of Behavioral Health. Good morning, and thanks for being with us.
Laura, what are the positive mental health impacts of students going back into the classrooms?
Well, good morning. Great to be here. The COVID pandemic has caused major disruptions for Ohio families, particularly for those with at-risk school-age children. The recent announcement for Ohio students to return to in-person learning may bring hope for normalcy, but more importantly, relief for children whose mental and physical health has been challenged by at-home learning.
So let's talk a little bit more about that. I'm sure you've been seeing a lot of issues with students who've been on remote learning so long. Can you expand a little bit more on some of the issues you're seeing with these kids?
Absolutely. And mental health is one of the most common diseases of childhood. About 1 in 5 children experience a mental health disorder in a given year. And children coping with mental health conditions have been especially vulnerable to changes due to the pandemic. All children may experience mental health impacts from prolonged social distancing, and research shows that loneliness in kids, especially over extended periods, is linked with anxiety and depression. And about 30% of parents say that their child is experiencing harm to their mental health because of social distancing and school closures.
Yeah, I mean, we've been talking about it a lot. We've been hearing and sharing, the tragic reality of rising suicide rates among teens during this time. What are some things parents need to be looking out for?
Well, mental health related hospital visits have increased by 31% in youth ages 12 to 17 years in 2020 compared to 2019. And suicide remains the second leading cause of death in youth ages 10 to 24. And experts say that youth suicidal ideations have increased due to the pandemic. So some of the signs that your youth may be contemplating suicide, including talking about suicide or death in great detail. Feelings of hopelessness. You may hear your youth say, I'm never going to get through this, or passive suicidal ideations like everyone would be better off without me, or presenting an emotional pain or anger, changes in mood or behavior, and withdrawing or isolating from activities.
And then finally, I guess, how do schools help in supporting the mental health of these students?
Great question. So untreated or poorly treated mental health conditions can affect a student's ability to learn, grow, and develop. School staff are trained to spot the signs of mental health concerns and refer to treatment and support. School districts across Ohio have made counselors available to students to help them cope with mental health challenges. And in-person classes increase the sense of community and support for children through networks of friendships, teachers, and support staff. And then to help children learn to identify, express, and manage their complex emotions in safe ways, schools are implementing positive behavioral interventions and frameworks to better support their students' mental health needs.
All right, Laura, we do appreciate all the information this morning, something we really need to stay on top of. There's been so many changes this year, a lot going on. Thanks for being with us this morning.
Thank you.
That was Laura Paynter, the director of Buckeye Health, Senior Director of Behavioral Health. If you or someone you know is dealing with thoughts of suicide or a mental health crisis, please call the National Suicide Prevention Lifeline. We have the number on your screen. It is 1-800-273-8255.